how these all different approaches that are evidence-based are accepted within the EAP. So what is a procedure? And can you
elaborate a little bit the procedure of scientific validation and proving the effectiveness of various psychotherapeutic methods within the EAP?
We see psychotherapy research and science a little bit broader than the not only from the medical standpoint, which is still valid for some aspects. So currently we have 18 modalities which are accredited in the EAP, and often you find them clustered under the 5 domains like psychoanalytic, cognitive, behavioral, systemic, existential, humanistic, and integrative. So when a member apply, when I say member, usually it is an organization which is representing a modality, a full modality. You name it. Could be psychoanalytic, could be systemic, could be CBT, could be anything. So when they apply to the EAP, they are assessed to which cluster they belong. And if it is something that is with a new name, let's say, we assessed if that modality somehow it doesn't already exist within the European Association. So the next part of the process is to assess each modality, to answer a set of questions and to provide evidence how they engage in a scientific and research conduct. So this means they do research, and this is not, if, as I said, this might not be limited. The effectiveness is just one type of scientific evidence, and it does not fully answer to the complexity of the human beings. And as WHO pointed out the limitations of the medical model, EAP issued in 2021 the position paper on the proper nature of policy applications and psychotherapy research, which you already mentioned that I was dealing with in the EAP. So that paper actually was really strongly supported by David Orlinsky. He was the founder of the Society of Psychotherapy Research, and he conducted over the years the most extensive research on which also EAP modalities are engaged nowadays, assessing how the psychotherapist development is done and how it is that effective. And also we had a support out from the position of the Professor Günther Schipek, which is one of the pioneers of the applications of the complex system in psychotherapy. And he also endorsed the EAP position and warning limitations of the currently used scientific frameworks used by the decision makers. So, which I already said, which WHO acknowledged nowadays, we do it, and also some other organizations like American Psychological Association is doing it since 2006. So we have to go beyond with the way we see science within psychotherapy. And this is a work in progress, and it's something that I noticed in the things that were not common in the times I was doing my own clinical trials, and I was applying with such methodology, wanting to assess the variation of the mood. Basically, the time they were looking to that type of protocol, and I said, okay, it's interesting, but it's not double blind. I said, right. But recently, I think in 2021, it was published in the World Psychiatry Journal, which is having an impact factor of 34. That actually the future of intervention science is relying on this variation and the variability. So actually, this is what our positions paper is claiming and emphasizing, being one of the ways to encompass the complexity of the human being. So we have to look to what methodology we use when we study a particular phenomena. So because the basic tenet of all the science is that the research methods used to study a particular phenomenon should be relevant and applicable to the nature of that phenomenon. So our assessment of modalities is oriented towards that process where we compared with the natural science methodology that, of course, provided a considerable progress for the physical health and the well-being of large population, but still is essential to recognize the differences in level of the complexity between the psychological and social phenomena that we're treating and we're approaching in psychotherapy compared with the biological phenomena treated by the physical medicine. So success in medicine usually lies in having the correct treatment, correctly applied in treating the patient pathology. While in contrast, psychotherapy engage with the patients as a person in a complex process, which is specifically treatment intervention or techniques form just one part of the approach. And that part has been, of course, recurrently shown in a large scale and statistically controlled field studies. They are not the most important part of the treatment. So I already mentioned the engagement of the psychotherapist with the already changed recently. There are days since it was published of position of and the guideline of WHO, and I would like to emphasize that basically there are two of their policies, namely the policy number 2 and 4, which are oriented to on the right-based, person-centered, recovery-oriented, and recognizing the mental health systems to transition nowadays from the institutionalized care services to the community. And we know that most of the psychotherapy work in the community-based approach. And also the policy number 4, which is discussed the providing the assessment and intervention to support comprehensive and offer choice. And that was the case also with the NICE guidelines for depression in adults, which was actually addressed by by it a stakeholder position with a large number of psychotherapeutic psychotherapeutic organizations that actually showed the fact that the former guidelines were very restrictive. And nowadays, the new guidelines for the psychotherapy in depression adults, they go in exactly what we see here, that WHO emphasizes in offers of choice. And EAP is an offer of choice. That's why the modalities, you cannot have just one psychotherapy that fits all needs. So, and also we are looking to the person-centered. We put the person in center of our work and the recovery orientation, not only symptom removal. So it is fully answered by EAP. Those policies are fully answered by the EAP members. So along effectiveness, we add some other dimension of the person. And this is the way we approach the scientificity of our modality.